Okay, we're live. Okay, I hope this is recording. Let me make sure if there's anything that needs to be pushed. Any buttons? I don't think so. Hopefully this goes onto the internet somehow. But this, so Audrey from Meridian, this is Kim and Dr. Roach here to talk to everybody about outpatient palliative care. And we have in-person participants who may ask questions. So if you hear people in the off camera, that's who they are.
Hi, so like Audrey said, I'm Nathan Roach. I'm one of the palliative medicine outpatient providers here in the Treasure Valley. We have Cam with us.
My name is Kim Matias. I'm a social worker with the outpatient services. So thanks for having us today. We just wanted to provide you some information about palliative care. That could be really helpful for patients to know how we might be able to be a helpful member of your care team. We are a team that includes medical providers, nurses, social workers, and office staff in the Treasure Valley. We are a non-oncology palliative care clinic. So St. Luke's has palliative care embedded in oncology, and we see patients that are referred for non-oncological diagnosis, many times with respiratory illness. We have a couple of locations for our clinics. Our largest site is just across the grass next door in the Montview building here in Meridian. We also have a clinic embedded in the heart failure clinic downstairs. We're there twice a month. And then we have a clinic in Boise that's in the Elks Rehab building off Robbins Road. So that's our Boise site. We also do telehealth. So if coming into a physical clinic appointment is a burden, or maybe just a trek if people live outside the area, or whatever reason, we do a lot of telehealth via the Epic applications. So those are options for patients in Idaho and in Oregon too.
Cool. So in terms of kind of what we do with palliative medicine, like Kim said, we are a team. And we work together for people who have serious chronic illnesses. That can be like COPD, heart failure, dementia. We really see a wide variety of patients and diagnoses. We don't take the place of your other doctors, so you would still see your pulmonologist, your primary care doctor, any other specialists. We're just another member on your team helping to care for you. It is good to know that we can be involved at any stage of your illness. So from the time you're diagnosed with COPD and then kind of throughout your life, we are different from hospice in that way. Hospice is more at the end of life, last 6 months, but we can be involved much earlier than that. You can still receive, treatments that are intended to cure or treat your illness while you're seeing us. So we really provide that care kind of any point in your life. We help in a few different ways. So we do help with symptoms related to chronic serious illness. So for example, people with severe COPD who have a lot of shortness of breath, we help by prescribing medicines to treat the symptoms. We don't prescribe medicines like disease modifying medicines, so like inhalers to improve your lung function, steroids, things like that. We really focus on symptom management in addition to what you're getting from your lung doctors. Another big part of what we do is we really try to get to know who you are as a person, your life meaning and value, and make sure that your healthcare matches up with who you are. We understand that your wishes for your healthcare are very individual to you, and it's not really a one-size-fits-all for you. So we really try to put you at the center of your own care. We do that in a few ways. We ask some what-if questions to see if there are things you would or wouldn't want for your care in the future. We try to make sure if you have documents that talk about who would be a good decision maker for you if you couldn't make decisions, we can help you fill those out. And then we also help to see if there are any caregiving resources that you might benefit from. in order for you to be really successful at home. So those are some of the kind of big overlying reasons why we see people. Given that we have really strong social work support in our clinic too, we do see a lot of patients who have like caregiver burnout, caregiver distress just from having to care for someone with a chronic illness. So I think that's another key part of what we do and what we assess for at all of our visits. If you're having to use the ER or being in the hospital a lot more than you used to, that's a good indicator too that having a conversation with us about your goals of care and what you're willing to kind of undergo in the future is another kind of good indicator for seeing us. In general, we like to be involved earlier rather than later because we feel like we can help you kind of figure out your goals for your care and navigate as your life changes related to your health, rather than being at a later stage where maybe you've undergone things that you didn't necessarily want to go through and you just weren't able to really express or advocate for those things. So now Kim's going to talk about how you all can get to our clinic and see us.
Yeah, so if you feel like palliative care would be helpful for you, we do need a medical referral to come to the clinic. So you could request that either from your primary care doctor or one of your specialists, like your pulmonologist. We have a really great relationship with the pulmonology community, so we'd expect that to be really well received. Or any other specialist that you're working with could make a referral to our clinic. They do not have to be an in-network providers. We have referrals from community providers that may not be St. Luke's affiliated. That's not a criteria for being referred into our center at all. And if you'd like to get more information about palliative care, about the care that we give in our clinic, there's some brochures that were provided and we've left with your team. There's also a website that patients might enjoy looking at called getpalliativecare.org. It's really great information about what is palliative care and what palliative care could do for you. And then you can also check the St. Luke's website and search in their palliative care and you'll get more information about our clinic and palliative care in the system as well. And just a little bit of what it looks like when you come to clinic. Most often, the patient appointments is with a medical provider and a social worker. We don't have full staffing for always social work assignments and visits, but most frequently it's with two people to help meet your needs. And our patient appointments are scheduled much longer than other medical appointments, commonly between an hour to an hour and a half to allow a lot of time to get to know patients, understand their history, their concerns, and talk about their values and priorities. So we have a real gift of time that we're allowed in our clinic for these longer discussions that can be pretty complex. So just to give people an idea, can be a little bit anxiety producing to go somewhere totally new and have no idea what to expect.
So now we'll open it up to any questions.
She's so excited. Yes, yes ma'am. You first. Yeah.
My first question is, never having heard of this previously, I always thought palliative care was associated with hospice.
Yeah.
Because that's usually how I've heard of it discussed. Can you give some examples of the kind of palliative care that might affect better breathers kind of folks?
Like before they get
Sure.
to that hospice
Yeah,
stage.
before that,
Right.
yes, so what
For
kind
sure.
of things would, give me some examples.
Sure.
Yeah.
So I'll repeat the question just in case. Just wanting some clarification on like specific ways palliative care could help people in the Better Breathers Club and how is it different than hospice. So for example, if someone had a newer diagnosis of COPD, we could meet with them, kind of get an idea of how their daily life is. Are they needing any assistance with completing their daily tasks like house cleaning, laundry, or personal tasks like bathing, dressing? We talk about what they know about their disease, what they've been told about the prognosis and the future of their disease. knowing those things, are there any things that they're worried about? For example, they're worried that they're going to need more care than what their family can provide in their home. They're worried about having lots of symptoms as their disease progresses. And then based on that, we start figuring out, like, for example, if you're needing more caregiving needs at home, how can we get you plugged into a caregiving agency so you can stay at home but get better support or more support? If you're having lots of symptoms, are there medicines that we can try to help relieve some of your symptoms so you're able to do more of your daily tasks on your own? So we see that as kind of being the bridge from what you're getting from your pulmonologist and then hospice at the very end of life. We're kind of a bridge in between those. So we see people at any stage. So often we have people who are following with us for many years. And as their disease progresses, we are kind of checking in, problem solving for any new issues that are coming up with their health, their caregiving needs, and things like that.
That's a great example. Thank you. So my next question is this. How would somebody in like a Better Breathers Club, how would they get in touch with you? Do you guys have, I mean, I realize you have more than one office, but what do we tell our physicians so that we get a referral?
I mean, hopefully you could just tell them you've been learning about palliative care and you feel like it would be helpful for you. I do think it might be helpful for patients to know palliative care is not a well understood specialty, not only in the general public, but also even in terms of the medical world. So sometimes physicians even may misunderstand that you may be asking for, just like you're saying, something like hospice, or to transition your care to a different care team. So it's possible you might need to give them a reminder that we wouldn't be assuming care. It'd be just to add another player.
Would it be a good idea to take one of your pamphlets with us?
I guess it sort of depends on who you're talking to. And the St. Luke's Poem Group has quite a good familiarity with us.
Okay.
I'm hopeful that there'd be less need for you to be burdened with education, but sure, there could be variability there. So hopefully a request on your part. And I believe in a lot of patient advocacy. So if you weren't getting the result you wanted and you have an active primary care physician, they may make that referral. We communicate a lot with care teams. So, in St. Luke's, we can see notes and they can see ours, but we're really proactive, making sure that other people that are active in your care are seeing the plans that we're creating too, so that they have a lot of continuity and consistency for patients as well.
Well, I'm really glad to hear that that's what you guys do. And I'll tell you why, because as an example, when I was diagnosed, I of course went into overdrive because that's what I do. So I immediately got my post figured out. I got that done within the first month because I had no idea what the progression was. All I knew was I'd seen my dad die of emphysema. And so I knew what that looked like and I knew what I did not.
Yeah.
From that perspective.
Right.
But I don't think a lot of people have that same perspective. I mean, some of the people that I've talked to, I don't think most of them have that. They don't have an example in front of them of what it can look like. Yeah. So I think it's really important, for somebody who has none of that to have a clue. Yeah. And I can see that would be extremely valuable. You guys would be absolutely wonderful in talking about those things. So thank you for doing that. I really appreciate the fact that you do it. So, for example, I'm going to ask another question because I will not shut up. Let's say, for example, you have COPD or something, similar, anything like that. And for the most part, you can handle it yourself, but you're fearful of how long can you handle it yourself? And you do not want to go into your children's house to be cared for. Right or wrong, you may feel that you would be a burden then, and you don't want to be a burden. Is this rather personal? Yes, it is. What can happen in that situation? How do you assist?
So we explore that person's values and priorities, and then try to talk about what are some other ways to prepare for the future.
Mhm.
What other resources exist, and the realities of what resources don't exist.
Yes,
And we aren't motivated for any agenda, whether that be intensive medical interventions or hospice or nursing homes, or we're really there to just walk alongside our
and
patients.
see what the options are.
And whatever whatever their goal is, doing our best to support that goal to be successful.
That's fantastic.
Yeah,
That's
so
really great.
we do find a lot of patients may not have a good understanding, exactly like you're saying, about what later stages of their disease might be like. Some patients prefer not to have that information and live in the present, and they do better. And so that's where we partner with. And some people would like more information and preparation. And so that's where we spend more of our time. So it really varies person to person. And resources vary, like you said, family support,
Sure.
finances, things vary too. So we give very individualized care in that way.
That's fantastic.
Yes.
I have a question. So for the people who see a palliative care specialist in the hospital,
Yeah.
is there a pretty smooth transition if you want to continue that outpatient?
Yes. So the question was about if you see one of our team members with palliative while you're here in the hospital, hospitalized, is there smooth transition? So yes, for the most part there is. We work really closely with the palliative team members who work in the hospitals in St. Luke's. And when that happens, when they're seen by our hospital team and then discharged, typically either the palliative team member who saw them in the hospital or the hospital doctor will make a referral to us for our clinic, and then we continue whatever discussion, symptom management was going on in the hospital. So we try to make that a pretty seamless process as much as we can.
And then
But it's not automated.
it's not automated.
Right.
Okay.
So if someone sees a palliative care, has a consultation in the hospital, and they know they want to come to clinic, they might make sure and ask, because we don't automatically see every patient after discharge.
Okay. And then as far as like cost, it's billed through your insurance, and so it's a normal doctor visit copay kind of deal?
Yeah, for them, what we would expect is that we should be covered just as your insurance covers any other specialist, like going to your pulmonologist or an orthopedic doctor. You
Okay.
could check your insurance specifically, but that's usually how we're covered, is like any other specialty.
And when we get the referral, our front office staff will check your insurance to see what the cost would be. And then if there are any issues, they let you know about that ahead of time, so you're not surprised at your first visit.
Excellent. And then you said even out of network, so for example, if someone's VA, do they come to this clinic too, or do they have their own kind of outpatient?
We have patients who are veterans and get some of their care at the VA, and we see them as well.
Okay.
It just depends on what their preference is.
Okay.
I'm not entirely sure about how much of an outpatient palliative clinic they have at the VA.
Mm-hmm.
So it might be that they don't have that there. But if they wanted to see us here, that's no issue. We have patients who get their care at the VA.
Awesome.
And we see that too.
Excellent. Any questions, Karen? Okay, I think
All right.
that's it. Thank you guys
All
for
right.
coming.
Thank you.
I really
Thank you for having us.
hope this recording works for all those who are watching online.
All right. Thank you.